About half of all counties in Kentucky are currently experiencing high transmission of COVID-19 as cases rise across the country. Fayette County is one of them, but things downtown look much different than they did this time 2 years ago. LEX 18's Mike Valenti and photojournalist Brian Stahl wanted to know how people are feeling about this phase of the pandemic, and they took a different approach. That's the LEX 18 big story at 11.
If only we could have a reprieve from the pandemic, a blank slate. But here we are, talking about it again.
We're just doing a story about COVID.
We know most of you are sick of telling us how you feel about COVID. So we asked you to write it down instead. Any word or words that come to mind when you think about the current state of the pandemic. The first word on our board, normal. Another, quiet. Annoying.
It's been too long. Been way too long.
The amount of emotional energy expended during the pandemic can understandably be exhausting.
I've seen so much lack of sympathy and lack of compassion over the past 2.5 years.
There's one word on that board that health experts would especially take issue with. That's the word over. They'd argue that's furthest from the truth, that the pandemic is very much alive, and that in places where transmission is high, people can't let their guard down.
I wish the pandemic was over.
Pediatrician Dr. Caitlin Iddings says the BA.5 Omicron subvariant appears to be fueling the most recent surge.
Caseload is starting to go up again, and I think that unfortunately come this fall we might even see more level of spread.
For some of you, warnings like these are scary.
There are a lot more variants that keep popping up, and it's kind of changed my entire young adult life.
And for healthcare workers, the ongoing fight against these variants is frustrating.
Seeing that the effects are still happening, it's very frustrating working as a team with the nurses and as a tech.
So even 2.5 years in, there are those of you who are doubling down in following the guidelines.
Wear a mask when requested, stay a safe distance from people, and don't follow fake news.
And whether you think COVID is confusing or unpredictable,
Just don't know what's going on right now.
the virus is still here. Dr. Iddings says there's one word missing from the board, and that's hopeful.
We can learn to deal with this and live with this and have sort of a new normal.
And hopefully soon, we can wipe the slate clean. In Lexington, Mike Valenti, LEX 18 News.